What?
Good afternoon, everyone. Thank you for being here this afternoon. I am Gibby Harris. I'm the Public Health Director here in Mecklenburg County, and I have with me Dr. Raynard Washington, our Deputy Health Director, as well as Meg Sullivan, our Medical Director. We've got a few brief comments from each of us, and then we'll be available for questions. So I need to let you know, at this point in time, we have 115,518 cases of COVID-19 that have occurred in our county since March of 2020. We've had 990 deaths in Mecklenburg County. Unfortunately, our 7-day average of cases was just reported this morning at 92. That's an increase since the 14-day average of 74. So our number of cases is going up. Hospitalizations are at 49 average for the last 7 days. That's an increase over the last 14 days. And our percent positivity rate is at 5.2% over the past 7 days, and that is an increase as well. So as you can see, all of our numbers are going in the wrong direction. We are seeing the same thing nationally. We're seeing increases in case counts, hospitalizations, also specific increases in 12 to 15-year-old population. The state is seeing some significant increases in cases and hospitalizations. And a lot of those increases are in 0 to 17-year-olds, including some outbreaks that they've seen at summer camps in the state this summer. Unfortunately, the Delta variant is the most prevalent variant or strain of this vaccine that we're seeing these days. And unfortunately, it is very transmissible. And that's what we're seeing with some of the outbreaks and the fact that it has become so prevalent. Most of our positives that we are seeing are not fully vaccinated. I want to say that again. Most of our new positive cases are not fully vaccinated. We are seeing some breakthrough infections of people who are fully vaccinated, but what I will tell you at this point is many of them are asymptomatic, and those who do have symptoms have milder symptoms and are very much less likely to be hospitalized because of it. One of the things that we have seen over the past week for us is that 71% of our cases have happened in individuals less than 39 years old. 25% of our cases have occurred in those less than 20 years old. And the flip side of that is less than 8% of our cases have happened in individuals who are 65 years old. We know that our 65-plus population is the most vaccinated population in our county. So you can see the benefit of being vaccinated in terms of being able to deal with the strains that we have out there right now. In terms of our vaccines, we are 50% partially vaccinated in Mecklenburg County at this point. That's great news, but it's also not good enough. We have seen improvements, but are still seeing disparities among our African American population and our Hispanic population. In addition to that, we continue to see some disparities in our census tracts that are specifically within the Crescent, and we're continuing to make significant efforts there to get people vaccinated. And we still need improvement, obviously, among our younger populations with our vaccines. So the message here is to get vaccinated. That is what is going to get us out of this pandemic. And in the meantime, especially if you are not fully vaccinated, you should be wearing a mask when you're in public. That's for your protection, but also for the protection of others. We have many children in our community who cannot be vaccinated at this point, and it's our vaccination rate that's going to help protect those children, especially as they go back to school. So the one message I have for people is to get vaccinated. The next message under that is always leave home with a mask. You never know when you're going to need it and when it's appropriate to wear it, whether you've been fully vaccinated or not. Dr. Washington is going to talk to us a little bit about the Delta variant, and then Dr. Sullivan will give us an update on vaccines.
Thanks, Gibby, and good afternoon, everybody. Thank you for being here. Always great to see your faces. So just a quick update on Delta variant. We have been working at the department to establish a surveillance effort so that we can understand and know what's happening with variants here in Mecklenburg County. And so we have set up a partnership with StarMed Healthcare and UNC Charlotte to be able to sequence a number of positive cases that happen here in Mecklenburg County among our residents. And so we started this process with the first group of cases just a few weeks ago. And so just earlier this morning, we did receive results from that first batch, and we can confirm that the Delta variant is here in Mecklenburg County. We did have an outbreak at a local shelter here. We sequenced a number of cases from that outbreak, and we're able to confirm that the majority of those cases were in fact the Delta variant. So again, as Gibby just said, I use this as an opportunity to continue to remind folks and encourage people that the best thing we can do right now is to all get vaccinated to protect ourselves and those around us. We will continue to scale up our program, our surveillance effort, to make sure that we can continue to monitor what's happening with variants here in the community, and we'll be reporting more detailed information as we have it available. The genetic sequencing takes several weeks. It can take up to 14 days to get the results. And so we're excited to have this pilot off the ground. We haven't really been able to do this previously, and so we will be continuing this effort moving forward to keep folks informed and also to inform our response. So thank you all.
Good afternoon, everyone. I am happy to be here today just to provide a brief update on the COVID vaccine for Mecklenburg County Public Health and the county as a whole. So to date, we know that over 550,000 Mecklenburg County residents have received at least one dose of the vaccine, and over 500,000 are fully vaccinated, which is a reason to celebrate, but we know we still have so much more work to do. Here at Mecklenburg County Public Health, we continue to engage in significant collaboration with all of our vaccine providers and community outreach providers in the community. We know that vaccine continues to be widely available at no cost and with no appointment needed throughout the entire county. And we also continue to learn every day more and more strong data that supports the effectiveness of the vaccine, particularly in preventing severe disease and death and in limiting spread in our community, including specifically against the Delta variant. And as we see the increased numbers that Gibby just discussed, I will also reemphasize that getting vaccinated against COVID-19 is the most effective way to protect yourself and others from getting sick with COVID, and everyone ages 12 and older should be getting a vaccine. Just wanted to take a moment to highlight two quick notes. The first is that we at Mecklenburg County Public Health are currently providing the COVID vaccine on a walk-in basis at both our Beatties Ford and Billingsley Road Health Department locations, and we'll also begin doing so next week at our Valerie C. Woodard Community Resource Center. We are also offering all other routine immunizations, and especially during Adolescent Immunization Month in July, I want to take the opportunity to remind parents to ensure that their children are up to date on all of their routine immunizations, including the COVID vaccine for adolescents ages 12 and older. At the end of this month, we will be hosting specific adolescent vaccine events where the COVID vaccine will be available for anybody, including parents, and encourage families to call or check our website for specific details. The second thing I will just say is we continue to work hard to provide equitable access to the vaccine in our community, including providing factual information and convenient access to the vaccine for anyone interested individuals who have been unable to visit a vaccination site. So this week, we launched the Doses to Doors program, which builds upon existing county public health efforts like our home-based vaccination program and ongoing collaboration with community partners to conduct outreach to provide COVID-19 vaccine information and addressing questions and concerns. We're utilizing members from well-known community organizations, including Action NC, including Kipro and Symmetry, and members of our public health community response team who have been trained with the most up-to-date information on COVID vaccines and to conduct outreach in the communities to identify individuals who are interested in receiving the COVID-19 vaccine. Trained public health staff then administer the vaccine to those interested individuals who have consented to receive the vaccine. We are excited to continue these efforts as part of our broader strategy to ensure equitable, convenient access for factual information and vaccine in the community. And we really want to continue to encourage anybody who is interested in receiving a vaccine in their home to contact us via phone or online. I'll just end by saying, as the data clearly demonstrates, COVID continues to be in our community and appears to be spreading, particularly among unvaccinated individuals. And again, we continue to see strong, indisputable data that the COVID vaccine is safe, effective, and saving lives. and especially in the face data showing increased spread of a highly contagious, potentially more severe variant, it is more urgent than ever now that anyone ages 12 and older get vaccinated. Thank you.
We'll take questions now. If you have someone in particular that you'd like to ask that of, you can let us know that as well. Yes.
I guess this is for either Gibby or Raynard. How bad do the numbers have to get before the mask requirement comes back? We know you guys issued the stay-at-home order before the governor, so the county could be first.
So we will watch that. I don't think we're there yet. I know that there's not an appetite in our community for that. Unfortunately, we are seeing, as we've mentioned, our cases go up, and we want to encourage people to get vaccinated. That's the answer. Nobody wants to put that mask back on. I'm still recommending that people don't leave home without it. Take it with them, have it available in any situation where they may need it. But at the same time, if you get vaccinated, it's less of an issue for you and for the community. So we're going to continue to push that. It will be, things would have to change quite a bit probably before we ever think about any more restrictions, but we never say never.
Gibby,
Yes.
this might be a question for you or for Dr. Washington. Can you say more about the Delta variant outbreak at the local shelter? How many cases were Delta variant? What was the time frame on that outbreak? And can you say which shelter that was?
Yeah, I guess it's a matter of. We sent the first initial 8 cases for sequencing. Of those, we were able to definitively confirm that 5 of those 8 were the Delta variant. The other 3 were not definitively confirmed that way. And then the outbreak at the shelter, I believe it is the Salvation Army shelter. That's the only shelter currently outbreaks that is, so it's not like it's not known. And then the outbreak at the shelter, I think at closing has had roughly 40 to 45 cases. I don't have the exact number, but it's in the data report that came out this afternoon. Sure.
Can you talk a little bit more about some of the disproportionate data you're seeing with Black and Hispanic community getting vaccinated, what some of those challenges are, and then more of how you're trying to overcome that?
Well, unfortunately, we're at that point in time where all of the people who really wanted to get vaccinated have already been vaccinated. And we also know that many of our health disparities that we see in this community are in our African American, Hispanic communities, our people of color. And some of that is due to lack of access to services. Some of it is due to lack of trust of services. And there's concerns of cost. There's lots of different reasons why people might be hesitant to get vaccinated or just don't have the information about where and how. And so we're working with Action and See as they're talking to people and learning from people what their hesitancies are, why are they. But what we're discovering is that we need to deal with that one-on-one. So your reason for not getting vaccinated is not the same reason as Joe's not to get vaccinated. And I'm assuming that you're both vaccinated. So I'm not wanting to make clear that I'm not making any statements there. But if you were hesitant, your reasons could be very different. And so the benefit of doing the canvassing in the community is having one-on-one conversations with people and really understanding what their issue is and trying to address their specific issue. We're at that point. It's the one-on-one. It's not necessarily the large vaccination sites. We're not going to see those again, I don't think, not anytime soon. So that's a lot of our effort, and as Dr. Sullivan mentioned, we're actually, as they're going out and having these conversations, we're actually sending public health staff out with them so that if they decide they want to get vaccinated, we'll have it available for them right there, make it as easy as possible. And we're finding that, too, with our younger populations, the more convenient, the simpler, the easier it is to get it, the more likely people are going to be vaccinated, but there's still, within our younger populations, is the issue of, it's not going to be a big deal for them, so why bother? Yes,
In
Jeff?
terms of hospitalizations, what percentage or how many people are not fully vaccinated and they're hospitalized?
At this point, I'd say what the state has been saying is 99%. 99% of the people who are infected are unvaccinated, and what I heard yesterday from the state was that the number being hospitalized was just as high, the percentage, unvaccinated people. Again, all of the data that we have is pointing to the fact that if you are unvaccinated, you are more likely to be infected, and you are much more likely to have severe illness and complications, need for hospitalization, and in some cases death, result from not being vaccinated.
Just as a follow-up, are you aware of any fully vaccinated person dying from COVID?
I'm not aware of any case of that. That doesn't mean that it hadn't happened, but I'm not aware.
School districts in the surrounding area around Charlotte, a lot of them have made masks optional for the upcoming school year. CMS has not announced their decision. What is your recommendation for CMS as they look to make that decision?
At this point in time, we're fully supportive of the CDC guidance on that, which requires children and teachers in school who are not fully vaccinated to wear a mask. The reality is, especially in our elementary schools, is none of those children have had the opportunity to be vaccinated unless, of course, they've been part of a study, and that's not a lot. There are a few. So we continue to recommend the masking in the school setting, especially for individuals who have not been fully vaccinated.
Can you touch on the Delta variant and its prevalence here? We're seeing that obviously nationally, but is it going to be this big of a deal here locally? And what about?
Yeah, as Dr. Washington mentioned, the issue of sequencing and of really understanding what the prevalence is in the community is a difficult thing to do. It's not you get a test and it tells you what variant it is right away. There's special lab efforts and equipment and things that go into sequencing to make sure you understand the prevalence. But just from this one sequencing situation that we have, that we've worked with UNC on, we're seeing very high prevalence. And as we're seeing, excuse me, more spread in our community and more rapid spread in our community, I think we have to make the assumption that we've got the Delta variant's pretty prevalent here.
And is that pretty concerning with its severity compared to just the original?
Absolutely. And I think, my concern is that we'll have two populations here. We'll have the vaccinated individuals who will either be asymptomatic or fewer symptoms if they get sick, and we're going to have the unvaccinated individuals or the not fully vaccinated individuals who are more likely to become infected when they're exposed, are more likely to become ill, are more likely to be hospitalized, because we're seeing across the country as well as other parts of the world that the Delta variant is a challenging one for us to deal with. So, again, we can't say it enough. The answer is vaccinations.
I know you said we're not at the place where everyone needs to put a mask back on yet, but do you foresee or have any recommendation for businesses checking if people are vaccinated or doing any kind of enforcement? I know it's really tricky.
It is tricky, and I don't know of very many situations where people are requiring that information of folks. I think that when I talk about making sure you take a mask with you, there may be some businesses, other places that are going to require people to wear a mask, all people. So number one, you want to have your mask with you. I know a lot of people threw their masks away when the restrictions went away, but you may need to get another one. But I don't anticipate any time in the near future where people are going to be required to show their vaccine card to get in someplace. That could always change, but right now I don't anticipate that happening. Mm-hmm.
Oh, sorry.
That's okay.
So I was talking to an infectious disease doctor today, kind of about the increase in other respiratory viruses, and she was mentioning that she feels like, I said, are you worried that this is going to get, even worse in the fall and the winter? And she said, no, because I expect we're all going to be wearing masks again by then if we continue the way that we're going, right? So I'm curious, do you agree with that? Is fall, winter too early? I guess, just sort of specifically, what benchmarks are you looking for?
Well, we'll continue to watch our data, yeah, and if our numbers continue to climb, we may be changing our recommendations, and it may be fall, it may be winter. It's just hard to tell at this point. But I do want to point out that we had a very mild flu season last year when everybody was wearing a mask. So we know that these masks prevent the spread of all of these other viruses that are out there that we run into in the fall and into the winter. So people will have to make their decisions. But again, a lot depends on what the data is showing us and what we're seeing in our community about.
So no specific, I know for CMS there was 5% test positive.
Yeah, we're not there yet. We're not there yet. I think, and again, we've got the Delta virus, the variant. We know that that's in our community. We know it's creating bigger issues for us. But as we're seeing our numbers go up right now, some of that might be coming from July 4th weekend as well. So again, we just have to continue to watch the numbers and see where they go.
More about the shelter outbreak, you mentioned 40 to 45 cases. Was that families and kids involved too? And then how many of those positive tests are you able to sequence?
Yeah, so I just checked, and I actually think the number is closer to 30, not 40. So just let me correct myself there. And they were all among residents, so there were none of the staff were infected as a part of that outbreak. There were that shelter does house adults and children, so there was a mix of cases among various folks who are residents of the shelter.
And then, so if it's closer to 30, how many of those tests can you sequence?
So I think we sent the initial 8 for sequencing, and we have not sent any additional out of that group. Again, as Gibby mentioned, sequencing is not so simple. It requires, in many cases, a recollection of a swab from a patient. Is also very costly, and there is no clinical justification for doing so. The state does have a surveillance effort that's happening at the state level that helps us understand, viral spread at the state level. It's not large enough to be able to measure at the county level at this point. So we're going to continue to sequence small samples as we can in the county as a part of the surveillance program, but we won't be able to give you county level prevalence numbers from the size of the samples that we're collecting.
But I guess, do you just assume, since some of those initial 8 tests were Delta, that?
Absolutely, yes. Yeah, absolutely.
Are you guys sending your sequencing to the state lab, or?
No, we're not. Sorry. So we've actually set up a partnership with StarMed Healthcare and UNC Charlotte. So UNC Charlotte actually has a sequencing lab, genetic sequencing lab on campus, which they have been as a part of a partnership they have with a federal organization. And so they've been gracious to agree to allow us to have this sort of relationship with them, that they will do the sequencing for us.
How do you determine whether to send certain cases or tests to be sequenced?
Yeah, so great question. We've prioritized cases connected with high impact outbreaks, as well as breakthrough cases and potentially reinfections that might be complicated for some reason.
Any chance you can, we see this a lot, where people are like, we've already dealt with COVID, the Delta variant, it's just people are just exaggerating, it's serious. How serious really is this for people who do get this specific variant of COVID?
I think for the individual in terms of severity of illness, I think that remains to be determined, the implications. The real implications in terms of severity are related to transmission. This variant is much more transmissible than all of the previous variants that we've been able to identify, significantly so, to the tune of 60 to 70% more transmissible than others. And so as a result of that, that means that when people get together, it's easier for one person who's infected to spread that virus to more people. The more people that become infected, the more likelihood that someone will be increasingly sick as a result of it. So I think the severity is really, the transmission is the pathway to increased severity. And so we're certainly concerned because, and I think as Gibby said, we don't want to get into a situation where we have two groups, the vaccinated and the unvaccinated. And I think we all know, people who are not vaccinated at this point are more likely to be around people who aren't unvaccinated as well. And so we're really working as hard as we can to make sure we get the word out to folks.
2 questions. Is this Salvation Army outbreak fresh? Did that just happen this week?
No, so this happened 3 weeks ago, and so the outbreak is really sort of on the decline for sure at this point. Most of the patients have recovered and are doing well, thankfully.
All right. Do you know how many people are still active?
I do not know off the top of my head. Yeah.
There's
Okay. Okay, so they've all been released from isolation, so everyone's been released.
And then I noticed on the data that you guys listed Anderson, a summer camp in Anderson, Crossroads Summer Camp, that has 8 residents have tested positive. Why was that included in our data if the camp is in Anderson, South Carolina? Are they all Mecklenburg County residents?
That's because they're Mecklenburg County. Oh, yes, I'm remembering the outbreak at the camp. There are a number of Mecklenburg County residents at that camp. So that's really just for awareness. We're not ourselves directly involved with the outbreak management from a public health department perspective, but because so many of our residents are involved, we have been partnering with them to make sure we are monitoring what's happening and getting the word out to folks who may also be going to that camp from the county. Great. Well, thank you guys so much for being with us today.
Thank you.
Thank you.